Hello, my name is Dr. Paul Kim. Today I'll be discussing Achilles tendon ruptures. So when you think about Achilles tendon injuries or ruptures, you have to think about, is it a complete tear or a partial tear? Typically a partial tear involves less than 50% of the Achilles tendon. Achilles tendon ruptures typically occur about 2 centimeters proximal to its insertion, which is the watershed area. Now, if you've injured your Achilles tendon, some of the simple tests that you can perform at home to see if you actually do have a rupture include the Thompson's test, which is a medial lateral squeeze of the calf to see if the foot moves, physiologic equinus, which when you're on your stomach and you bend your knees, there should be a slight contracture of both Achilles tendon, and a palpable defect. Other objective tests that you can do to evaluate an Achilles tendon injury include MRI and ultrasound. When you think about Achilles tendon injuries, there's 2 treatment arms, operative and non-operative. Non-operative treatment includes functional rehab as well as physical therapy. For non-operative treatment, the re-rupture rate can be up to 13%, and about 70% of people can return to their pre-injury level of activity. Aside from a equinus boot and functional rehab, I also like to implement platelet-rich plasma for patients that opt for non-operative treatment. For operative treatment of Achilles tendon injuries, you have about a 5% infection rate, as well as an 80% chance of returning to your pre-injury level of activity. The way I approach Achilles tendon ruptures surgically is using the Arthrex mid-substance repair kit, mainly because it has a faster functional rehab. I also like to use Arthrex amnion wrap, mainly for its growth factors, as well as preventing scarring of the Achilles tendon after repair. And finally, I do inject what we call bone marrow aspirate concentrate, which is a form of stem cells, and I always add the PRP, which is a platelet-rich plasma. You can never have enough growth factors. The surgical rehab is pretty straightforward. For the first 2 weeks, you're limited in terms of your ambulation, but starting at week 2 is when we get you walking in the equinus boot. Thereafter, each week you remove a wedge and you start physical therapy. I clear my patients usually for high-impact exercise such as running at the 3-month mark, depending on how the recovery is going. After being cleared for high-impact exercises at 3 months, it does take a lot more in terms of physical therapy and home exercise program to get to that level of pre-injury. It usually takes most people about 12 months to fully recover. Easy, fun, and resourceful doctor talk. Well, thank you for your time. I hope this was helpful. I definitely look forward to seeing you next time.